My name is Mike and I'm a nurse. I'm making this video as a CPR tutorial for the general public. Back here we have my associate, Annie, well, my little assistant, and we will go over the basics. One day you might find yourself in a situation where you want to help. This is designed to help you to recognize what's going on and then to know what to do. When you see someone go down and you want to make sure they're okay, you go up to them, say, "Sir, ma'am, are you okay?" You want to make sure they're breathing and that their heart's beating. So this is where look, listen, and feel comes in. Whenever I do it, I put my ear close to their mouth and then I'm looking down at the chest, looking for the chest rise. I'm also feeling for a pulse. I'm down there for about 10 seconds. If there's nothing in that time, then I need to start compressions quickly. There's a big push in the public for compression-only CPR, and it's very effective. Compression-only CPR should be at the speed of about 120 beats per minute. If it helps you remember, there's a common song, "Staying Alive." You can sing that in your head and you can do compressions to that beat. This next segment is for all of you parents who are wondering what to do whenever your toddler or infant is choking. And so we are going to use these baby mannequins in order to help us with the skills portion. This video is to help give you confidence to know what to do whenever you see that something's wrong. I usually get questions about choking infants or toddlers. Okay, so something's happened and their airway is blocked. We want to get it out. We don't do finger sweeps anymore. There's too much of a risk of pushing it farther. What we do is we do alternate back slaps and chest thrusts. So I'm going to teach you how to do your hands. Notice I'm sitting on a chair. This is exactly the position you want to be in because you want to use your body in the way I'm going to show you. You make a V with your hand and you cradle their jaw, let their mouth open in front of it. What we're going to do is you're going to support their body on your arm and your leg. If you didn't see anything come out, we're going to switch to finger thrusts. You pick them up, move them to your other hand. You've got your two fingers between the nipple lines on the breastbone, 5 times. So at this point, the baby is unconscious and now you need to switch to CPR. So we'll go over the CPR basics. Please use your phone to dial 911 and put them on speakerphone. They can walk you through the rest of the process. You're going to look, listen, and feel. You're looking for chest rise and you're listening for breath and you feel for a pulse on their arm, right by their bicep, and you just push your fingers right against their bone, see if you can feel the blood. You're going to do compressions first, and you're going to do 30 at a rate of 120 beats per minute. At this point, you put their nose in a little sniffing position to open up their airway. You'll give them 2 rescue breaths, and you want their chest to rise. You are strong enough to cause damage with your air, and so think fogging up a glass. You're going to want to cover up their nose and their mouth with your mouth, and look for their chest rise.